we're standing here this morning to talk about Senate Bill 328, which is a committee initiative that we have actually been working on with my co-chairs on the Insurance Committee, Senator Matt Lesser and Representative Sean Scanlon, along with fellow ranking member Cara Pavolak-D'Amato, and actually the governor's office since the end of last session. We met a number of times to go through three different initiatives that are designed to help reduce not only the overall cost of health care, but also the cost of insurance premiums for Connecticut families. Basically, what this bill will do is it will, number one, allow the importation of prescription drugs from Canada, pending federal approval and in cooperation with the Connecticut Department of Consumer Protection to make sure that any prescription that comes into our country is safe and reliable. The second aspect is an initiative that has been very successful in the Commonwealth of Massachusetts, and that is benchmarking. And under the leadership of Governor Baker, Massachusetts has been able to reduce the cost of health care year over year from what was 10% and more down to a current about 3.1%. Those two initiatives are specifically designed to focus on the cost, getting our arms, the state of Connecticut's arms around the cost, the skyrocketing increases in health care. The last initiative is to bring premium relief to Connecticut families. And the way that we would do this is through what's known as a reinsurance program, which would provide up to 7% reduction in premiums for Connecticut families through a general fund appropriation. We just received a new report done by the Wakely Group through Access Health that confirmed what we believed last year. And through the use of reinsurance, we could leverage up to 65% of the cost of that program through a federal 1332 waiver under the Affordable Care Act. I will say that this initiative, I think, is one that is comprehensive and global because it looks at not only the cost drivers, but also what it will cost the Connecticut family in looking to reduce the premium. And we couldn't be here today without the support of all four caucuses in the governor's office. And working through this policy over the past, I'm going to say, 6 or 7 months, and that we're very fortunate to have that bipartisan cooperation to get this bill to where it is today. With that, I'd like to turn it over to my fellow colleague in the Senate and chairman of the Insurance Committee, Senator Matt Lesser.
Thank you, Senator Kelly, and it's good to be up here with the four leaders of the Insurance and Real Estate Committee. The Insurance and Real Estate Committee has had a long track record of working across the aisle on the issue of tackling consumer protections in healthcare and in addressing some of the underlying cost issues that we're focused on. The bill that Senator Kelly is describing is an important step. It does some important things that will help provide relief to families and that will help us get our arms around the overall cost of health care over the long run. As Senator Kelly mentioned, the benchmarking program in Massachusetts, which attempts to limit cost growth by tying the cost growth to inflation or an inflationary metric, has been successful. It saved over $5 billion for Massachusetts consumers over the last few years. None of this would be possible without the great cooperation of Vicki Veltri and the Office of the Governor. Look forward to continuing to work with him and our partners in the executive branch on how we can do this. There are limits to how much this does. Certainly, we need to do more on the issue of making healthcare affordable for small businesses. But this bill is an important step and something we can work on together. Just with regard to the reinsurance, I think it is an incredibly important program. We had a report that came out last year that said that through reinsurance alone, we can save up to 20% on premiums offered to families on the exchange, but that requires a sustainable funding source. As you know, Connecticut is currently in the middle of a $66 million deficit, but looking forward to working with Senator Kelly and other partners to identify a sustainable funding source to make sure that that is something that does provide premium relief to families. So looking forward to providing this. And then, of course, the last part is safe importation of affordable Canadian prescription drugs. That's something that is easy to understand. We have to do something about the high cost of prescription drugs. It is outrageous that in this country we pay the highest prescription drug prices in the world. We're not pretending that this is a magic solution to that problem. There are certainly other things that we are considering this legislative session. We just had a hearing on Tuesday on a bunch of other proposals, but certainly bringing in safe, affordable prescription drugs from Canada is one tool that should be in our toolkit to help address the growing unaffordability of prescription drugs. Thank you.
And now I'd like to introduce the House Chairman, State Representative Sean Scanlon.
Thank you, Senator, and good morning. At a time when our constituents are looking to Washington and just seeing nothing but chaos and dysfunction, I hope that they will be inspired by the fact that we are standing here today as 2 Democrats and 2 Republicans to strongly support a bill that we've been working on for several months. This bill actually passed the House last year with 112 votes, which is a very strong sign of how much truly bipartisan support is here. We got to keep going in this vein. Democrats and Republicans across the state, they don't really care what party is getting results on this. They just want to see results because they're fed up with the high cost of their drugs, their health insurance plans, and they just don't see any end in sight. And by passing this bill and a couple other bills that we've been working on this session, we really can give them the confidence that there is something that's happening here and that we can make progress on this issue. They expect that of us. They elected us to solve problems, not just to fight about them. And by doing this today, we really will be able to show them that progress is possible when it comes to a tricky subject such as healthcare. And I'm just grateful for Kara and Kevin and the governor and Matt. We've been working hard at this. We can pass this bill and we can give them the needed results and relief that they frankly deserve. So thank you all.